Morning, everyone. So today I wanted to do something a little bit different. I wanted to include you and bring you guys into like more or less as to what it is of a life on the of a resident in this midst coronavirus crisis. Many people are quarantined, but many of the healthcare workers we have to be in the front lines and take care of patients who are in the hospital, especially. So today is March 21st. It's about 6:30 in the morning, and I'll see you around throughout the day. So it's still a little bit dark. The sun hasn't come out yet. It's so sorry about that. The In the hospital, it's been quite hectic. Multiple measures have been taken to not only like isolate patients, but not only on patients, but also on healthcare workers and us as residents. The COVID has like affected the but some of the measures like that have been taking place at the hospital. They've been moving the children out of the pediatric population, like out of the hospital. They've been also ramping up their like ventilator resources. In addition, I think that they've been trying to increase the number of ICU beds as a kind of preventive measure if things like go south. They've had placed the entrance as a checkpoint, the main entrance as a checkpoint in which everyone needs to go through to get their temperature. And we just got a communication yesterday. The program is kind of experiencing like we're getting a little bit short-staffed because the residents have been, some of them have been had to be quarantined. Yeah, if the patient's life is at risk, but any and every other like elective surgery is canceled. I have another friend who's like dental school clinics were canceled entirely until like mid-April, so they're at risk also of like graduating. None of the essential procedures have been are taking place or anything like that. So it's we're starting to really see a thinning of the workforce, especially. I will see you very soon. So I just got and I'm currently taking care of like oncology patients, and these are amongst the most one of the more vulnerable populations. So one of the best practices we do is like every single time we come in and out of a room, we wash our hands with hand sanitizer, like with soap and water preferably. And also there's kind of, because of this crisis, as I was telling before, the healthcare providers are getting like thinned out. Some of our attendings are had to be quarantined as well. So we're working with pretty much like what we got, and the shortage of masks as well has been hitting here. So today was like a very interesting day. It's 4 in the afternoon on a Saturday. We on a Saturday usually go chart check them first, see our patients in the morning, round with our attending, and finish the day like relatively early. But yeah, not today. Today was a busy day. I had a patient who presented with abdominal pain, but nurses called and she had increased abdominal pain when I went and saw her, and suspected surgical abdomen, or like very tender, very peritonitic abdomen. In other words, like we need to call surgery. It ended up like not being a surgical abdomen. She didn't need to go to surgery, but she did have continued like very tender abdominal pain, very difficult to control because this patient also uses prescription opiates, long-term, very high dose, but it's because she's a cancer patient. Also, we're discussing with our attending, because we have another vulnerable cancer patient, got a biopsy, but she started having some fevers here and there, and she started with a cough yesterday, and a little bit of short of breath, and everything. We did a blood culture, a urinalysis, a chest x-ray, a viral respiratory panel, like for the flu and everything has come back negative. And with this patient, we suspect COVID-19, so we're gonna await the results for that. We discharged the patient so that they can go isolate at home. So that was a significant issue too. So I said this morning that there's a shortage of and it's hitting the medical personnel getting diagnosed or getting any sort of, or getting positive to COVID-19, and because of the lack of protective equipment. But let's take one day at a time. We'll use our protective equipment as it's available. I'll keep you posted. But I'm very tired today. It's quite a long day, quite a hectic day.
Hi everyone again. So it's about like 9 p.m. in the night, and just kind of getting ready to go to bed for another long or short day tomorrow. It all depends. I've been keeping a track of the numbers, and at least here in Louisiana, where I'm at, the cases went up from 586 this afternoon to almost 800 in just a couple of hours. So yeah, this is a very concerning issue. So I'll keep you updated as we go, and please help you stay home. And if you have any sort of symptoms, please call first. Don't go into the emergency room, or if you have any sort of like severe symptoms, or any loved one has any sort of severe symptoms, please call 911 first. And don't get out of the house unless it's crucial for you to get out, because the situation is quite worrisome, and especially what we saw in Italy recently in the past 24 hours, where they had the highest death toll in a single day, averaging about 700 plus deaths, more or less. So please, everyone, stay safe, and I'll keep you updated.